CBS 2 News in high definition.
Nearly 30 million Americans suffer from debilitating, painful migraine headaches, and for some, medication just won't help.
Well, now CBS 2's Dr. Max Gomez is here to tell us about an exciting new approach that may cure migraines. How about this one, Doc?
That's right, Maurice and Christine. And the surprising new approach is surgery. Doctors have known for a while that a migraine headache often seems to stem from trigger points on the scalp and face. So a plastic surgeon in Cleveland reasoned that maybe removing the trigger point might ease or even cure migraines.
I couldn't take the light. I would sit at my desk blinking and pressure points here, the pain that would come up the whole side of my head. I would stutter.
The migraine headaches Dale Ida is describing would last for days at a time and would strike as often as half a dozen times a month. Nothing brought relief.
I went through acupuncture, epidural, spinal injections to block the nerves in my head. I've taken every pill imaginable.
The one thing that gave Ida some relief was Botox injections, like this woman is having for her migraines. They work by relaxing the muscles in the face and scalp, which is the clue that another type of treatment might also work.
If we can go in there with Botox and relax the muscles around these nerves, are we able to help these patients by taking away the trigger mechanism that puts pressure on these nerves?
That's what Dr. Kaveh Alizadeh proposed to do for Ida, take away the trigger with surgery. The procedure was developed by Dr. Bahman Gairon, seen here operating on a migraine patient. The idea is to find the nerve or nerves triggering the migraine and cut away the muscle that's compressing or squeezing the nerves, which sets off the headache.
If we can go there physically and release these muscles surgically, we can potentially cause a cure for these patients.
Ida had nerves decompressed at the back of his neck, along his temple, and in his forehead. That was exactly 1 month ago. Normally, he would have had 5 or 6 major migraines by now.
That's a week, that's 2 weeks, that's 3 weeks, that's a month of no migraines. Phenomenal. See, I'm actually believing now that it's going to last.
Now, the Cleveland surgeon has published clinical trials on the surgical approach and has found the surgery offers relief in up to 80% of migraine sufferers, and the relief has so far lasted for 5 years in follow-ups. But not all health insurance covers the surgery at this point. It costs about $10,000 if you have to pay out of pocket, but I guess some people will pay just about anything to get relief from migraines.
It's a bad, bad deal. So is this for everyone that suffers from migraines?
Well, obviously not for everyone. If you get good relief or reasonable relief from medications, it's not for you. But if Botox seems to give you some relief, that could be a clue that you've got trigger points there, that removing that muscle that's squeezing the nerve may actually give you some relief. And it depends on how often you get them, how painful they are.
Worth talking to your doctor about.
Absolutely.
Dr. Max Gomez, thank you.
All right. Speaking of relief, we all need some.